who's joined so far. We're going to wait about another minute as folks continue to trickle in, and then we will go ahead and get started. Thank you for being with us, everyone. It is Wednesday, May 21st. I had to take a pause there, and we are here for the provider information session. Thanks for sharing your email with us. You know that it is usually after a long work day. Before we get started, we want to make sure that we give an opportunity for anyone who needs interpretation to switch over to the channel. So on this next slide, we have a visual for anyone who might need to use interpretation support. We have interpreters in Spanish, Chinese, Vietnamese, Russian, and our wonderful ASL interpreters as well. Si está con nosotros y necesita interpretación al español, puede usar el icono en la parte baja de su pantalla y elegir el idioma de español. Tenemos intérpretes en varios idiomas esta tarde. Next, we will share how to use the question and answer tool. So for this webinar, we don't have the chat accessible. However, we have the question and answer, the Q&A feature turned on. So at the bottom of your screen, you'll also find a message icon, which you can click and enter your questions. We invite you to ask questions. If you are joining us via Facebook as well, your questions in the comment sections will also be monitored. After each topic is presented, we'll pause, and our fabulous colleague Ronnie will read through the questions, and we'll do our best to answer those as they come. If there are any questions that we are unable to respond to tonight, we will do our due diligence and follow up with you. You can see the Q&A feature there. And this is our agenda for the evening. So tonight we'll be covering the Every Child Belongs program. We'll provide some updates on employment-related daycare, and to close with a couple agency and program updates. These are mostly one slide, quick reminders for you to have and share as well. With that, I'll go ahead and hand it over to colleagues Katrina and Andy. Are you here? I see your name now. Okay. Katrina and Andy, who will be joining us for this portion. Katrina, the mic is yours.
Thank you, Karina. Hello, everyone. It is good to be with you this evening. My colleague Andy Bales-Molnar is also here with me, and I'll get us started, and then I will hand it over to her. So we are here to talk about Every Child Belongs. This is what we used to call the Early Childhood Suspension and Expulsion Prevention Program. And next slide, please. So the components that we will talk about this evening are training and technical assistance for early educators and providers, infant and early childhood mental health consultation, also for providers and educators. Every Child Belongs Connect, or ECB Connect for short. And we'll talk briefly about behind-the-scenes coordination among regional organizations. So each of these 4 things are components of Every Child Belongs. And with that, I'm going to pass it to Andy. Andy.
Good evening, everybody. And so if we go to the next slide, we can start talking a little bit about the Every Child Belongs training and technical assistance. And so one of the things we wanted to make sure everyone was aware of is that each region of the state has a child care resource and referral agency that is available to support educator professional development. I think we're going to put into the chat a link that will help you identify which region you're in and give you information on how to contact your local CCRNR. And when requested, a CCRNR staff member can come and meet you, visit your program, provide suggestions, talk over the phone, exchange videos, just really in general, have conversations about how to support your goals for your program and also how to support really thinking about how you want to set up your program to reduce and eliminate times when suspension and expulsion may be a consideration. They do this at no charge, and they're happy to meet with you at any time. Additionally, through Oregon State University, we have the Early Learning System Initiative, also called ELSI, and they are providing right now for Oregon educators only free e-modules on what's called the pyramid model. And the pyramid model is a proven framework of classroom practices that, when used, can reduce reduce the use of suspension and expulsion, but primarily it really gives educators some really practical guidance of classroom behaviors that can support social emotional development in children and classroom management. And so there are several modules that are available at no cost. They are in English and Spanish, and they do cover from infant, toddlers through preschool. And so thank you very much, Allison, for popping in the link that you can go to get to there. And then we're in the process of developing 9 new virtual trainings that will be on a variety of subjects, but really all within the theme of behavioral supports in early learning classrooms, again, including our infant toddler classrooms and family supports, knowing how important that family engagement is for that successful situation in your classroom and relationship between educator and child. So those will be launching by the end of the summer. I believe the developers are working hard on it as we speak, and they should be delivered to Delk by June 30th. And so then it's just a matter of getting them up onto OCCD. We can go to the next slide. So we wanted to just take a moment and talk about, when we say technical assistance, what are we talking about? And so technical assistance is really the process of thinking together with a technical assistance provider and an educator about something that they would like to set as a goal and how to reach that goal. And so it really is about, how are you changing practice in the classroom instead of a training, which would be how are you absorbing the information being presented to you, kind of like right now. So a technical assistance could be mentoring. It could be peer-to-peer learning, coaching, or consultation. And so in the Every Child Belongs frame, we're really thinking about that consultation piece of being able to have conversations with a technical assistance provider and really discussing what the goals are, being very reflective on how you've reached those goals and what you want to see different in the classroom once those goals are achieved, and then how what action steps can be taken in cooperation, in relationship with that TA provider to achieve those goals. And I think with that, I'm turning it back over to Katrina.
Thank you, Andy. Next slide, please. So another component of Every Child Belongs is infant and early childhood mental health consultation. A lot of words. So we often use this abbreviation, IECMH consultation. So you'll see that here on the slide. So mental health consultation is something that a lot of people don't know a lot about. So it's not very familiar to us. So let's talk about what mental health consultation is. It is a relationship-based approach that pairs a mental health consultant with early educators who work with infants and young children in childcare and preschool settings. So it is also a collaborative process between the mental health consultant and the early educator, in which the educator's knowledge and expertise are valued and respected. So the emphasis really, I want to emphasize the word collaborative. It is not something about an expert coming in. It is a consultant, someone to talk to, think together with, work together with to do some problem solving and to think together about what's going on. It is also designed to be culturally responsive and trauma informed. So what is consultation not? So it is not about fixing children. The mental health consultants don't have a magic wand to come in and say, I know just the thing to fix the child. No, that won't happen. It is also not therapy for the child or the family or the educator. It's not the same as coaching, and it's not telling educators what to do. It is not a directive or an expert model. I talked about that a moment ago, in which the expert comes in with all the answers. The idea is that the answers come together between the consultant and the educator and also the family in working together. So down at the bottom of the slide, IEC-MH consultation will be available in all regions of Oregon. It is not yet available, but it will be. The organizations that will be hiring the mental health consultants are called regional service providers. You may hear us say regional service providers of infant and early childhood mental health consultation. Okay, next slide, please. This is the timeline. I mentioned it is not yet available, but it is coming. So right now, or sorry, let me say not right now, starting in July to September of this year, mental health consultation services will begin in some regions. So it will be just a few regions, and we don't quite yet know which regions those will be, but we will be sure to share that information when it's confirmed. Beginning in October through December of this year, mental health consultation will expand to more regions. And by this point, it will cover the majority, but not all of the states. By next January or February, mental health consultation will expand to the remaining regions. So then by that point, we'll have all regions getting started or having gotten started with mental health consultation. So then from July 2026 and ongoing into the future, mental health consultation will be available statewide. Mental health consultants are starting to be hired in the first regions and are going through onboarding and training. And then throughout across time, we will be doing continuous quality improvement. We'll be looking at data, looking at outcomes, making changes to the services when we determine that something isn't working or could be working better. Next slide, please. So Every Child Belongs Connect. This is another element of the Every Child Belongs initiative. So Every Child Belongs, or ECB for short, ECB Connect. This is the new name for what we used to call the Warm Line, or we also have called it the Support Request Form or the Support Request Process. It is an online portal for early learning and care providers to request support when a child may be at risk for suspension or expulsion by connecting educators to the right services. So those services may include technical assistance, like Andy talked about. It may include infant and early childhood mental health consultation. It could include other services such as early intervention or early childhood special education. It'll be tailored to the individual situation. So the thing to hear is this is the place to go to request support. It is not yet live. It will be before in the coming months. The next slide, please, is the timeline. Oh, the timeline is coming later. Request ECB Connect support when? Well, when it is available in your community. It is not yet available. It will begin to be available in July in a few regions. Request support when you, the educator or provider, want to talk with someone about how to support a child or a group of children to be successful in your early learning environment. We know that young children can present with challenging situations. It is a challenging job to care for young children. And sometimes you need to reach out to talk to somebody or to get help in problem solving a specific situation. Reach out to ECB Connect when you need that support. So also, if you think you may not be able to meet the needs of a child in your early learning environment, or if you think you might want to ask a child to leave, reach out to ECB Connect. Next slide, please. So the intent of ECB Connect is to have one common place for early learning and care providers to access support via an online form when experiencing challenging childcare situations. So the first phase will be what we're calling early access, beginning in July 2025, just a 6 weeks or so from now. And again, that will only be available in a few areas. We will share what those areas are when they're confirmed. Phase 2 in October will expand to a larger group of regions. And then in phase 3, January of 2026, it will expand to be available statewide. So it is starting where the regions, the CCR&R has identified staff who will be ready to provide the technical assistance, the pieces that Andy was talking about, where the regional service provider has hired a mental health consultant and that consultant has been onboarded and ready to go, and where behind the scenes regional coordination is established. And the purpose of the regional coordination is so that you, as the educator or the provider, you don't have to know what service you need or what help you need when you contact ECB Connect. But there will be a regional team that will receive your request, will talk with you to gather more information, and will coordinate to find out who's available and what is the best fit for what you're experiencing. Next slide, please. This is a visual of how ECB Connect will work. So at number 1, you, the educator or provider, identify a need, and you go to ECB Connect and fill out the support request form. Number 2, you receive a response, most likely by phone, from someone at the regional level to gather more information, to say, tell me more about what's going on. Number 3, the regional partners identify the specialist to respond. And number 4, that specialist who's identified contacts the provider to discuss support. So the form will ask if it is okay to text you, if you want a phone call, but there will be a chance to talk with somebody on the phone to discuss your situation. So then the specialist provides support that is tailored to your situation, with the goal at number 6 that these collaborative efforts, keep the child in the program. Now there's a little asterisk there that says occasionally it may be determined that a transition plan is needed. So our goal is to keep children in their placements, but we're not going to be able to do that all of the time. When it happens, it should happen in collaboration with the support specialist, the educator or provider, and the child's parent or family, and hopefully in a planned way. Next slide, please. We're at the end. So for more information, please visit the DELC website, and thank you, Allison, for adding the link to the chat. I think we have a few moments for questions.
Thank you for the time, Katrina. We don't have any questions in the Q&A at this time.
Okay. Thank you very much.
Thank you so much, Katrina and Andy, for all of that information. And if there are questions, please remember you can put those in the Q&A feature and the conversation. I actually see a question that just trickled in, and I believe this is for you too, which says, will the technical assistance be in-house?
That is a great question. In-house, I am wondering, does that mean at the childcare program location? I'm going to guess that that's what we mean. We are building resources to make that possible. Okay, great. I saw confirmation in the Q&A. We are building resources to make that possible. There may be times when we also use something like Zoom or another virtual platform to connect. And it goes back to the support that is provided will be tailored to your situation. So not every situation will require on-site support, but some will, and we are working to make that available. I see a question that asks if I'm able to disclose which regions this may potentially be rolled out to. It will by January of 2026. We will have it in all regions. Right now, we have not confirmed which regions will be first. We're getting close. As soon as we know, we will share which regions will be first.
Okay, Katrina, we can go ahead and move on to the ERDC updates. And anybody that puts a question in, and if we have your name and your email is not anonymous, then we will be able to answer you and also be able to maybe even answer you tonight if we have enough information. Okay, thank you so much for this time.
And good afternoon, everyone. My name is Jennifer Eras. I'm the Interim Child Care Assistance Program Manager, and I've got a few updates for you tonight. So if we want to move on to the next slide. So this slide is a public-facing website for employment-related daycare data that we have. It gives information about the total caseload that we have, the amount of caseload that we have connected to childcare providers, and this is updated on a monthly basis. So just to let everyone know, for the employment-related daycare program, you can see this is quite a bit of data, but it shows that our caseload is currently at about 16,000 families. We've had a wait list in place since November 2023, and that's where you can see where the caseload kind of evened out there. It was increasing pretty rapidly until that point. We also have a little over 11,000 families that are currently on the wait list. And the reason for the wait list is because we didn't have sufficient budget to continue to support the families that were applying for the program benefits. So at this point in time, we have no plans to lift the wait list. We're currently waiting for to hear from the legislature on our budget for the next biennium to see if we'll have sufficient funding to be able to pull additional families from that wait list. So it really is fully dependent on the budget. If you are interested in the caseload information, it is on, like I said, it's on this public facing dashboard. You can click on the county level data and it will give you information based on the county. So it'll say how many families are enrolled in that county, how many families are on the wait list in that county. And it also is available in both English and Spanish. And if we want to move on to the next slide. Okay, and so you saw in that previous one, there was quite a difference between the caseload as well as the families who are currently receiving child care benefits. So there's about 25% of our caseload, or 4,000 families, who are eligible for employment-related daycare benefits, but they don't have a provider connected to their case. So because of this, we've been doing outreach in several different ways. Back in November of 2023, we did a pulse survey, which was a very short survey with families, just trying to gather some information from them about what was happening and what they were looking for in childcare. In the beginning of this year, in January, we sent out a text message to families who had open ERDC but were not connected to childcare providers, and we were checking to see if they wanted referrals to open childcare providers. And then in February and March, we asked family coaches who were working with families who were on TANF to talk to the families about the different types of childcare needs that they had. So we've done quite a bit of outreach with families who have open ERDC benefits, but they don't have a provider connected. When we sent the text message in January, we ended up getting about 115 families who replied saying that they would like more information, and 66 families received referrals from about childcare providers in their areas. With the pulse survey and also with the family coach outreach, we sorry, I will talk a little bit slower. But we have found that there are a lot of different barriers that families are dealing with in trying to find childcare in their areas. Some of the things involve the schedules not matching up or the families not having adequate transportation to get to childcare providers that would support their families. And we know that a lot of families that we serve, they don't have stable schedules. So they may not be a Monday through Friday 8 to 5 schedule. And that was one of the barriers that families were finding. Also with the Pulse survey, the information that came out was saying that the families were looking for certain types of childcare that were not available in their areas. And so we're just continuing that search to dig in a little bit deeper to find out what it is that families are needing. Because like I said, we have 16,000 families who are approved for ERDC, but we only have about 12,000 that are currently connected to childcare providers in their area and receiving payments for children. So we're going to keep digging into this, and we will definitely share the information as we find it. In the meantime, if you want to move on, we've made some changes to the way families can search for childcare online. So if we can move to the next slide. So with the Find Childcare Oregon, some of the changes that we've made include how families can actively search for childcare providers. We've included a new piece in there where families can search for a provider based on them being an active ERDC provider. So this alleviates the family. They don't have to choose a certain type of provider. They can just say that they want an active ERDC provider. So someone who's currently receiving payment through the ERDC program, and they can search in that manner, which will give them a little bit broader search. And if we can move to the next slide. Some of the other changes that we've made is we've created an ERDC logo to try and make it visually easier for families to locate and identify providers who are active ERDC providers. So when I say an active ERDC provider, this is a provider who is approved to receive payment from the employment-related daycare program, and they have received payment in the last couple months. And I'll touch on a little bit deeper information on that in a second. So if we can move to the next slide. So when this information shows up, there's that ERDC logo. And though we have a wait list in place, we do want to stress that we always encourage families to apply for ERDC. We would never discourage a family from applying for ERDC just because we have a wait list. There are bypasses in place that would allow families to bypass a wait list and still qualify for ERDC. So we always want families to at least submit that information and check to see if they meet one of the bypasses. Families don't have to complete an entire application to bypass a wait list. They can just sit down with someone to see if they meet one of the bypasses. And they don't have to go through the entire process. But on the Find Childcare website, when you hover over the ERDC logo, it'll give more information about the ERDC program, and it will also hyperlink to how families can apply for program benefits. Let's see, and if we can move to the next slide. There we go. Right. And so some of the changes that have happened is, so now we have for the ERDC referrals, families can search to see if the provider is an active ERDC provider. It will display that information on there showing if they're open for referrals. And then ERDC, sorry, so it's considered an active ERDC provider if they've received payments within the last couple months. And then for providers who are newly listed for the ERDC program and they haven't received payment yet, they won't quite show up on this just yet. We do have a plan to make changes to this in the future so that any active provider who is active but maybe hasn't received payment, they will show up as well. But right now it's based on payment, and then we will make those changes to based on if the childcare provider is just active within the system. So that's coming up in the next couple months. And if we can move to the next slide, please. There we go. So programs can update their referral status at any time with Find Childcare Oregon through their provider portal if they've been enrolled in the system by their CCR&R. If you're a new program and you haven't received an email from Find Childcare Oregon asking you to update your program information, you may not have been enrolled yet by your CCR&R, so you can reach out to that local CCR&R to make sure that you're connected to them. And then you can receive access to your Find Childcare Oregon account. You need to complete your program enrollment with the CCR&R, the Child Care Resource and Referral Agency. Let's see, and if you have any, you can also request to change your referral status by contacting your Child Care Resource and Referral. So you would have to do that prior to the update of prior to the update of the Child Care Resource and Referral status. And then if we can move to the next slide. There we go. Thank you so much. So when you access the Find Childcare Oregon provider portal, you'll be able to edit your status. So there are several different statuses that you can select. There is one that's called accepting ERDC. So this option is if you're open to accepting ERDC families and your ERDC listed and currently eligible, you can set your status as not accepting ERDC. And then you can also set the status as relative care only. So this is if you're a relative and you haven't gone through the additional training to be a regulated subsidy childcare provider. But then you can also set the status. The final one is willing to become ERDC listed. So even if you haven't completed the status, you can select that in case that's something that you're open to for referrals in the future. And that is the last one I have. So apologies, I've had some issues with my access tonight, and I hope everyone has been able to hear me clearly. Definitely let me know if you have any questions.
Jen, thank you for that time. We do have a question. How can providers connect with families who haven't found a provider yet that are eligible for ERDC?
That is interesting. So with your status on Find Childcare Oregon, that is definitely something that is helpful because we refer families back to 211 info and to Find Childcare Oregon when they're searching for a provider. Like I said, we've done some outreach to our TANF eligible families who have ERDC benefits. We've been talking to them about what they need in childcare and what they're looking for in childcare. I really wish I had some of the results from those surveys, but we don't quite have them back yet. But the thing that we are constantly doing is essentially referring families back to 211 info if they're looking for childcare. So with those statuses and how you're listed with Find Childcare Oregon, willing to accept subsidy, or if you haven't already submitted a listing form to become ERDC eligible, you can submit a listing form. Licensed providers have very few additional things that they would need to do to become ERDC listed. And once you're listed, you're in the system for at least a year. So once you're approved, you're in the system for a year. and the only thing that you would need to do is you would need to receive some sort of payment from ERDC to be in the system for as in an approved status for longer. So we can go for a 2-year period if you've received payment. So that will definitely help families to receive those referrals and to let them know that you're available and able to provide care.
Thank you, Jen. Those are some exciting options coming up. We have another question. If a family has a child with a special need, do they automatically qualify for ERDC, or do they still look at their income?
Families do still need to be eligible based on income and other requirements, regardless of if a child has a special need. Special needs within the ERDC program, we have a few different levels. So there's special needs age. So if there's a child who's, say, between the ages of 13 and 18, and they have additional needs where they need supervision and they need care, they can qualify fairly easily. Families just have to state that they have a child who has an additional need. For example, like a child who is a foster child would automatically qualify for special needs age. We've had several different situations that qualify for this. This includes a parent who is working a graveyard shift and you don't want your 15-year-old staying at home all night. We've had families that have had safety risks. So their home was recently broken into, or there were domestic violence concerns. They just need to talk to their ODHS worker to talk to them about the need to have their child supervised, and they can get that older child to receive those benefits. There's also an additional level of care. So if children have mental health or physical health needs with medical documentation, we can pay a higher payment rate. So we can pay what's equivalent to the infant rate to make sure that that child has additional options for the childcare in their area. Of course, paying a higher rate gives them more options to childcare that's available. And then there's also the high needs rate, and that's through an assessment program through Inclusive Partners, and that can pay an additional payment on top of the special needs rate through the Department of Human Services. That can help to pay for a variety of different services, including additional staffing or additional needs at the child care site to make sure that the child has the needs covered that they require.
Thank you, Jen. This is our last question for you. We got this from Facebook. So are the ERDC rates increasing?
The ERDC rates are, let's see, we're currently in negotiations with childcare provider unions. So in case folks don't know, we do have childcare provider unions. Licensed exempt family providers are currently represented by the SEIU Childcare Provider Union. And then licensed family providers are currently represented by the AFSCME Childcare Provider Union. So like I said, we're in current negotiations. Apart from the negotiations, the federal, the Child Care Development Fund, so the federal funding does say that we need to try to pay providers at what's called the 75th percentile of the market rate study. So every 2 years, we reach out to all the childcare providers and try to find out what rates they're charging. The 75th percentile is essentially saying in my area, if there are 100 childcare slots available, how much would I have to pay to be able to buy 75 out of 100 of them? So that's what the federal government says we have to pay at. And we just had a new market rate study that came out the last couple months. Like I said, we're in negotiations with childcare providers, so I do anticipate we may have some provider rate increases. I don't know what those would be just yet. We're a little bit early for that, so probably in a few months we should be able to share a little bit more information on that.
Thank you, Jen. We really appreciate it.
Thanks, everyone. I can share about our agency and program updates for this evening. We have just a few for you all. As a reminder, this section of our information session are just quick reminders, sharing links with you all. We may not have the ability to answer questions, but if you do have something in the Q&A box, we can get back to you. So the first update we have is that DELC has a new web page about federal updates. So this is a new spot for our incident response team, which is comprised of subject matter experts across the department, where they can share updates with you all regarding any federal changes that you might be curious about. So I will drop this link in the chat for you. And we can go to the next slide. Next, we are excited to share that we have a new license type at DELC. So certified outdoor nature-based programs are coming this July 1st. As the name says, these are programs that are primarily serving children outdoors. These programs are for preschoolers through school-age children. And if you have questions about this license type, if you're curious to explore it more, please contact your regional licensing office or your licensing specialist. We will have a new page on the DELC website for this license type soon, but in the meantime, if you're curious to see what the outdoor nature-based rules look like, I will share that link in the chat for you. And we can go to the next slide. Okay, so good timing. Jen was just talking about the market price and supply study. So as she said, this is a study we conduct every 2 years to identify what providers are charging families across the state. So we're capturing geographic data and mapping out those prices. Oregon State University released the findings of the 2024 study this spring, and the link is available for you all if you're curious to see what rates are. As Jen said, this study will help as we are in collective bargaining with the childcare providers that have contracts with the state. So more news to come soon. That might be our last update. Yes, I will hand it over to Karina.
Thank you, Al. I think we covered it. I do want to just circle back and see if there are any questions before we wrap up this evening. Ronnie, were we able to get to all of our questions? I know there's some that we've covered in
Yes.
responses. If you had questions, we've been typing out some answers, but
There is one in the chat right now. It says, could an option to reduce the current wait list be not increasing the rates for ERDC? Increases are awesome, but not at the risk of increasing the wait list for families. Families are really struggling to secure care for the wait list. Is Jen still with us?
Yeah, I am still here. At this point in time for the 2025 to 2027 biennium, which is what our budget is set for, so that would be July 1st, 2025 to June 30th, 2027. We don't have sufficient funding to continue supporting the families that we already have on the ERDC program. So we're really waiting to see what happens with our budget. We don't have a finalized budget for that biennium to know what's going to happen with families on the wait list. So our main concern is to continue supporting families that are on the program right now. If we have sufficient funding, we will definitely look at pulling families from the wait list. But those are our priorities at this point in time. And unfortunately, it's just too early to know exactly what our budget's going to be set at.
Thank you, Jen. Jen, we also had 2 questions earlier that we were able to answer in the Q&A around, would providers be allowed to use that ERDC logo on their own websites for their childcare?
I think if they're approved to receive ERDC benefits, you can definitely use that logo to help convey the fact that you're currently approved and that you're able to receive benefits or receive payments, sorry, from the ERDC program.
Thank you, Jen. I believe let me just check again. We had a question about when would we have more information about the 25-27 funding cycles?
That's going to heavily depend on the legislative session. So I know we just had a new economic forecast that came out on May 14th that has given the legislature a little bit better idea of how much it's biennium, but they're setting the budgets for not only our program, but for the entire state. So the legislative session, since we're in an odd year, this is currently a long legislative session that should last through the end of June. So by the end of June, we should have some definite answers on what's happening for budgeting and for the programs.
Thank you, Jen. And we also had a question earlier about, are there any resources for families who are currently on the wait list that might help them in the meantime with the childcare cost?
Yes, so 211 Info definitely has information for families based on their area. It really depends on the age of their children and the needs that the family has. So the employment related daycare program is not the only childcare assistance program within the state. There are, for example, there are teen parent contracts if it's a teen parent who needs childcare. There's a baby promise program, the preschool promise program. Apart from state funding, there's also Preschool for All in Multnomah County. So the family's best bet is to really contact 211 Info to find out what other resources may be available in their area.
Thank you, Jen. At this time, we don't have any questions in the Q&A. And Karina, I'm not sure if we had any in Facebook that should be addressed.
We don't see anything else on Facebook. It's checked and I don't see anything there.
Okay.
So I believe that wraps up the information we have for you today. Again, thank you to our DELC colleagues who are here to share this information, but more importantly, to all of you who are out across Oregon, working with and supporting children, families, and working alongside providers as well. So thank you so much for everything. As we close this webinar, you'll be prompted to a survey as well, which we really would appreciate you completing, and it helps us get feedback around what information is helpful to you and how we can continue making these sessions supportive for you as well. Thank you so much for all of the information. Last reminder is you will find the recording in English and Spanish and the slides as well, English and Spanish, on our website. Our Department of Early Learning and Care, you'll find the provider information sessions. There is a tab there and you will find the recording, but also the slide deck. So if you want to go back and review the slides, you need people reminders, you will find those there by the end of this week is our plan. Thank you so much again for your time, and we will reconvene in couple months. Usually we're doing these every 2 months, but we recognize that July is in the midst of summer, so we are most likely holding off until September for that reason. But know that we are here to support and to answer your questions, so please don't hesitate in reaching out. Thank you so much, everyone. May you have a wonderful evening.